This talk is about adult EEG. This talk will be conducted in a question and answer format. The first question is, most of the waves in an adult awake EEG 20 years or older are in the alpha and beta range. A true, B false. I have shown you this figure in prior talks. It depicts the strength of the different frequencies in the different regions of the brain during a wake. Most abbreviations are self-explanatory, except for the letter P that stands for parietal, which corresponds to the central region in the current EEG terminology, and the letters LVF that stand for low voltage fast. After 20 years of age, the prevailing activity is in the alpha and beta range, as you can see. In the frontal, in the central, and in the occipital region. So the answer to this question is true. Next question. Beta activity can be considered abnormal based on its presence in a given behavioral state. A true, B false. Beta activity was introduced by Berger. This term is usually used to indicate activity over 13 Hz. Beta activity, for the most part, is a good thing to have. Beta activity can be divided based on its frequency into sigma, beta, gamma 1, and gamma 2. As you can see in this classification, in the wider scope, the lower limits of beta activity, and in the narrower scope, beta has been restricted to activity between 15.25 and 24.75 Hz. This back and forth with definitions, often contradicting themselves, seems to be a constant in the classification of EEG activity and rhythms. Another way to analyze beta activity, as well as any electrical activity in the brain using regular EEG, is to correlate the activity in question, in this case beta activity, with the behavioral state in which we find the activity in the patient. The behavioral state of a patient can be divided in awake, which can be subdivided into awake and worried, awake relaxed with eye open, and awake relaxed with eye closed. Or it can also be divided into the stage of sleep. Sleep can be subdivided in non-REM stages 1, 2, and 3, and stage REM. Beta activity, which can also be called beta rhythm, is present in all states that we have so far mentioned. Beta activity in these different stages for the purpose of EEG interpretation can be used for different ends. Beta rhythm in sleep stage 1 can be used to evaluate symmetry. Beta rhythm in a worried patient is also used to evaluate symmetry. Beta rhythm during a relaxed stage, regardless of the eyes being open or closed, is used to evaluate symmetry, distribution, and reactivity. So the answer to this question is false. Next question. The amplitude of alpha rhythm is normally higher than the amplitude of beta rhythm. A true, B false. Beta activity is usually low average. Its highest voltage, about 60 microvolt, is present in early childhood from 12 to 18 months of age during sleep, stage 1. But for the most part, the amplitude of beta activity is equal or less than 25 microvolts. The amplitude of beta activity is always lower than the amplitude of alpha activity or rhythm. That is so in the same epoch. Remember the principle that the faster the wave, the lower the amplitude. As you can see in this epoch, if you compare the activity in the frontopolar region, which is beta, with the activity in the occipital region, which is alpha, you can notice the difference between the two. I have represented this relation in this figure schematically. So the answer to this question is true. Next question. The amplitude of beta rhythm in the left hemisphere is higher than in the right hemisphere. A true, B false. The relation between beta amplitude of the left and right hemisphere is a little bit complicated. In most individuals, the beta activity in the left hemisphere is 35% lower than in the right hemisphere. That is, it is as much as 35% lower in the left hemisphere than in the right hemisphere. So if the amplitude of beta activity on the right is 10 microvolts, then the amplitude of the beta activity on the left hemisphere could normally be as low as 6.5 microvolts. So the answer to this question is false. Next question. In a normal EEG, if the amplitude of beta rhythm in the right hemisphere is 10 microvolts, the amplitude of the beta activity in the left may be as low as A 6.5, B 5, C 10, D 12.5. So if the amplitude of beta activity on the right hemisphere is 10 microvolts, the amplitude of the beta activity on the left hemisphere would normally be from 6.5 to 10 microvolts. Yet this statistical reality does not correlate with detectable pathology on the left hemisphere in most patients. So the answer to this question is 6.5. A. Next question. If the amplitude of the beta rhythm in the right hemisphere is 10 microvolts, the amplitude of the beta rhythm in the left hemisphere should be dash microvolts or less to be called abnormal. A 6.5, B 5, C 10, D 12.5. As I mentioned before, up to 35% the beta activity can be lower on the left side than on the right side. Yet, as I also mentioned, this asymmetry is usually found not related to any pathology. Yet, to call the left hemisphere beta activity significantly abnormal, that is, to find beta activity consistently associated with an structural left hemisphere abnormality, the amplitude difference should be 50% That is, the left hemisphere should be 50% or lower than the right hemisphere. So the answer to this question would be B. Next question. If the amplitude of the beta rhythm in the left hemisphere is 6.5 microvolts, the amplitude of the beta rhythm in the right hemisphere should be dash microvolt or less to be called abnormal. A, 6.5, B, 5, C, 10, D, 12.5. Since to begin with, beta activity in the right hemisphere should be higher amplitude than that of the left hemisphere, a right hemisphere beta activity amplitude less than 25% of the beta activity in the left hemisphere indicates a clinically significant abnormality. So in this case, the beta activity amplitude in the right hemisphere of 4.9 or less would be a significant abnormality. So the answer to this question is B. Next question. The amplitude of beta rhythm in the left hemisphere is lower than in the right hemisphere because the left skull is thicker than the right skull. A true, B false. The left skull is said to be thicker than the right skull. So, despite the right and the left hemisphere producing beta activity with the same amplitude when recorded intracranially, this is not the case when the beta activity is recorded extracranially. When recorded extracranially, the activity on the left will be smaller than the activity on the right. So the answer to this question is true. Next question. Please take a look at this epoch and decide whether you think it is A, normal, or B, abnormal. This epoch has an appreciable difference between the beta activity in the right frontal region and the beta activity in the left frontal region. To determine if an asymmetry represents a clinically significant abnormality, often we could refer to as an abnormality, follow 3 steps. First, subtract the lowest value from the highest value. In this case, the result of such an operation is 20. Second, turn the difference, in this case 20 microvolts, to a percentage of the highest value, which in this case is 50 microvolts. The result is 40%. The third step is to determine the lowest side and apply the following rule as presented in this frame. So in this case, the lowest side is the right, and the rule says that if the difference is more than 25%, it would be abnormal. So the answer to this question is B. Next question. Please look at this epoch and choose the correct answer. Notice that I have just inverted the nomenclature of the channels to make a point. I have placed the nomenclature of the right derivations on the top and the nomenclature of the left derivations on the bottom without changing the tracing itself. So the answer to this question would be arrived at by following the same steps that we described before, which are: first, find the difference, in this case 20 microvolts, then make a percentage of it, which in this case would be 40%, And the third step, select the lower side, in this case the left, and apply the rule that corresponds to that side. Since 40 is less than the difference allowed between left and right hemisphere, that is, since 40% is less than the difference allowed between the hemispheres, and the one that is affected is the left, which to be called abnormal has to be more than 50% lower than the right, the answer to this question will be A, normal. Next question. Which of the following is true regarding beta rhythm? A, frontal beta rhythm is blocked by touch. B, posterior beta rhythm is blocked by eye opening. C, posterior beta rhythm is blocked by mental concentration. D, all of the above. As you can recall, beta rhythm during the relaxed awake state can be used to evaluate symmetry, distribution, and reactivity. During this period, we can find beta activity at 3 different locations. We may encounter beta activity in the frontal region, which at times spreads a little bit posteriorly towards the central region. We can find beta activity involving the entire scalp or restricted to the posterior regions. The beta activity at this location have different reactivity. Frontal beta activity, especially the beta that extends to the central region, is blocked by movement or intent to move or by touch. The blocking, which occurred by touch, is maximal on the contralateral side that the patient is being touched. The frontal beta activity blocked by touch is considered by some authors fast mood rhythm because it shares the same typical reactivity with this rhythm. Beta activity involving the entire scalp has no reactivity. Posterior beta activity is blocked by eye opening and performing calculations, and is often considered fast alpha since it has all the characteristic, that is all the similar reactivity than the alpha has. So the answer to this question is D. Next question. In adults, during drowsiness, beta rhythm is maximal in the posterior head regions. A true, B false. During drowsiness or stage 1 sleep, beta activity may be confined to the mid-frontocentral region, or in children, it may be confined to the posterior regions. So the answer to this question is false. Next question. Which of the following is not true regarding beta rhythm? A, drops in amplitude before other rhythms. B, rhythms from each hemisphere are not in phase. C, enhanced by a skull defect more than slower rhythms. D, not enhanced by hyperventilation. Beta rhythm is the most sensitive rhythm to the effect of injury and of distance between the cortex and the surveying electrode. Hence, interposed tissue or edema between the cortex and the scalp will greatly reduce its amplitude. This is so because biological tissue behave as high-frequency filters, so the longer the distance electricity has to travel in a biological tissue, the more reduction of the fast activity in relation to the slow activity will occur. In this frame, I am representing delta activity on top and beta activity in the bottom. They are being gathered from an schematically intact skull without any evidence of pathology. Now, in this new frame, I'm adding the structure in red to represent blood between the brain and the scalp. And as you can see, there has been a great reduction in the schematic beta activity and none in the delta activity. Now, in this new frame, I have added an aqua color between the scalp and the electrode to represent edema. And again, as you can see, beta activity is greatly reduced and delta is not. The beta rhythm, as depicted in this frame, is being collected by two electrodes in the same hemisphere, and as you can see, it has a certain amplitude. Now, I am adding an electrode on the opposite hemisphere, but keeping the distance the same as when the electrodes were in the same hemisphere. And as you can see, represented in this frame, the beta activity being collected from electrodes in different hemispheres is larger than the beta activity collected from the same hemisphere. This demonstrates that beta rhythm is not in phase in both hemispheres. Were it to be in phase, it would be much lower than the beta activity collected from the same hemisphere. Another important characteristic of beta activity is being the most vulnerable of all regular EEG rhythms to bridge effect. As you can see in this frame, the beta activity on the right, that is the side of the hole, is larger than on the left. Please notice that the alpha activity is not affected. The affectation of the beta more than the alpha activity is not dependent on the location of the hole. In this patient, the bridge rhythm is in the central region. This frame shows two epochs. The one on your left shows a bridge rhythm in the beta range. The one on your right shows a bridge rhythm in the alpha range. Notice that the frequency of the beta rhythm does not slow down during its appearance as a bridge rhythm, whereas the frequency of the alpha activity slows down during its appearance in the bridge segment. The final ingredient to answer this question is that beta activity with frontal distribution and lower frequency is enhanced by hyperventilation. So the answer to this question is D. Next question. Which of the following is not true regarding beta coma? A. Better prognosis than alpha coma. D. Suggests drug intoxication. C. Beta activity is maximally posterior. D. Suppression with stimulation is a bad prognostic sign. Generalized beta activity and anterior beta activity are common patterns seen in patients with beta coma. They indicate a good prognosis, especially if the beta activity is reactive. As you can see in this frame, beta activity involves the entire scalp but is maximal in the frontocentral region. The good prognosis attached to coma associated with beta rhythm is not only due to the fact that beta coma is often encountered after medication intoxication as it was in this patient. The good prognosis also extends to patients with hypoxic ischemic encephalopathy. Patients with ischemic encephalopathy and beta activity in the EEG have better prognosis than those with coma and an EEG in the alpha, theta, or delta range. Diffuse and frontal beta activity can also be seen in non-comatose patients induced by drug intoxication. Beta activity with prominent spindle may occur in patients with mental retardation, especially those with lissencephaly. And beta activity representing ictal activity may occur anywhere in the scalp. So the answer to this question is C. Next question. Which of the following drugs do not enhance beta activity? A. Chlorohydrate, B. Benzodiazepine, C. Penicillin, D. Phenobarbital. Beta enhancing drugs include benzodiazepine, barbiturate, and chloral hydrate. So the answer to this question is C. Next question. Please look at this frame and choose the most likely answer. Notice that the answer should be regarding the activity pointed by the arrow. The answer is C. Next question. The animal that most strikingly resembles man with regard to alpha activity is A. Monkey, B. Elephant, C. Dolphin, D. Dog. This frame shows pictures of brains of different species. The one whose alpha most resembles man is that of the dog. Yes, the dog, not the monkey. This frame shows a segment of an article written in 1990. It is the best article about alpha activity that I have ever found. It clearly explains many aspects of alpha activity, including that alpha activity or alpha rhythm is an intercortical organized and generated activity. Please take a few seconds to read the segment in this frame. So the answer to this question is D. Next question. Alpha activity and alpha rhythm are the same thing. A true, B false. Alpha activity include waves occurring with a frequency of more than 8 and equal to or less than 13 Hz. Alpha activity was described by Berger. Alpha activity may or may not be reactive. Alpha activity with no reactivity is present scattered throughout the adult EEG, forming part of multiple grapho elements, as well as isolated rhythms. Alpha activity with reactivity when selectively blocked by eye opening and triggered by eye closure in the relaxed state is called alpha rhythm, and when blocked by movement is called mu rhythm. So the answer to this question is B. Next question. Alpha rhythm is present in over 50% of all the epoch of an awake EEG in the adult. A true, B false. Alpha rhythm is best assessed with the patient awake, relaxed, and with eyes closed. It is important to stress that opening of the eyes and calculations, even with the eyes closed, block alpha rhythm. As we previously mentioned, alpha activity is present in all behavioral states. Alpha rhythm is present in different proportion depending on the behavioral state of the patient. When the patient is worried, it occupies less than 50% of the epoch. The same proportion occurs when the epoch is recorded with a person relaxed with the eyes open and during drowsiness. It is only when awake, relaxed, with eyes closed that more than 50% of the alpha rhythm will occupy an epoch. In stage 2 of sleep, stage 3, and during REM, alpha rhythm is not present. So the answer to this question is false. Next question. Which of the following criteria must be present for an activity to be defined alpha rhythm? A. From more than 8 to equal or less than 13 Hz. B. Absence upon eye opening. C. Block with eye opening. D. None of the above. I will go through this definition item by item because unlike alpha activity that is merely defined based on frequency, the definition of alpha rhythm is complicated. The frequency of alpha rhythm is usually given to be from 8 to 13 Hz. Yet, if we encounter an epoch such as the one in this frame, in which activity in the 5 Hz range is intermixed with activity in the 10 Hz range and in the occipital distribution, the 5 Hz activity would be called an slow alpha, and it will represent an alpha variant. In this frame, I am showing another example of an exception that is to the use of a frequency above 13 and still use the term alpha rhythm. As you can see in this epoch, some of the activity is in the 14 Hz range, that is some of the occipital activity, yet by virtue of its location and its disappearance upon opening the eyes, it will still be judged as an alpha rhythm. And in this frame, I have also brought up an example of when the frequency criteria is not met and still we use the term alpha rhythm. In this epoch, you see activity in the 22 Hertz range that, because of its responsiveness, that is, its appearance with eye closure and disappearance with eye opening, is also considered to be alpha rhythm despite it having a frequency above 13 Hertz. So the definition of alpha using frequency alone is certainly not appropriate, and there's enough instances where activity below 8 Hz will be considered alpha rhythm, and activity over 13 Hz will also be considered alpha rhythm. Alpha rhythm is further defined by its posterior dominance. This epoch shows a posterior dominant alpha rhythm as it is encountered in most patients. Yet, in 35% of adults, the alpha rhythm voltage maximal activity is not in the occipital region, and in 32% of normal young adults, alpha activity is widely distributed, predominantly in the central or temporal region. It is hard to say if the last statement refers to alpha rhythm or alpha activity because I was unable to find the source, which I have included here in this frame. The source comes from some study that was done by NASA quite a few years ago. Another characteristic used to define alpha rhythm is that it is best seen with the patient relaxed and relative mental inactivity with eyes closed. To be certain the patient is not drowsy, when the patient is relaxed with his eyes closed, you may ask the patient to count but not to do mathematical problems, because as you know, doing mathematical problem has the same effect as eye opening, or almost the same effect as eye opening. This epoch shows in the occipital derivation the presence of alpha rhythm with eye closed and the absence with eye open. But at times, alpha rhythm may be seen for a few seconds upon awakening from drowsiness while the eyes are open. This is likely to be due to a brief alerting response. This epoch is an example. As you can see, when the patient is aroused from drowsiness, despite the eyes being open, alpha activity will appear. This is called paradoxical alpha rhythm. So as you can see, this second characteristic of alpha rhythm also has some contradictory findings. The final point regarding definition of alpha is that it is blocked or attenuated by eye opening, attention, mental effort, and tactile or auditory stimulation. The effect of eye opening is seen in this frame. Alpha rhythm disappears with eye opening. The effect of calculation with eyes closed can be seen in this new frame. As you can see, there is a reduction in the alpha rhythm once the subject starts doing mathematical calculations. Notice in this patient the effect of eye opening and calculations. In this frame, as you can see, when the eyes are open, alpha activity is blocked. In the lower segment, you can also see that when calculations are performed, with the eyes closed, there is a drop in the amplitude of the alpha rhythm, but still it's not blocked as it was when the patient was opening his eyes. Both of these responses are considered characteristic of alpha rhythm. Yet, the unilateral failure to block alpha rhythm with eye opening does not detract from calling the ongoing alpha rhythm so, as it occurs in the bank out phenomenon, of which I will say a few more words in a few minutes. But for now, see what is happening in this frame, that on one side the alpha activity is blocked but not in the other side. So the answer to this question is D. Next question. During drowsiness, the area involved by alpha becomes more restricted. A true, B false. During drowsiness, the area involved by alpha rhythm becomes enlarged. It spreads forward. So the answer to this question is false. Next question. Which of the following is not true? A squeak phenomenon is normal. B. Hyperventilation may demonstrate the presence of alpha rhythm when no alpha rhythm is present in the tracing. C. 10% of people have alpha less than 15 microvolts. D. The frequency of alpha drops significantly with age. Normal alpha rhythm may be low amplitude. About 10% of normal adults have alpha rhythm with an amplitude of less than 15 microvolts. This frame is an example of very low or non-existent alpha rhythm, despite closure of the eyes as it would be expected. And in this frame, we can see that when alpha rhythm is apparently not existent, it may show up after hyperventilation. Squeak phenomenon, which consists of faster alpha rhythm immediately after closing the eyes that slows down after a few seconds, is a normal phenomenon. This frame shows an example of a squeak phenomena. Notice the frequency following immediately after eye closure is 14 Hz, where a few seconds after is 11 Hz. The side-to-side difference of alpha rhythm should be less than 1 Hz. It is usually 0.5 Hz. The amplitude of alpha activity in the left hemisphere is less than on the right hemisphere. The reason for this is the same as we stated when we spoke about beta activity. That is, a skull that is thicker on the left than on the right. This frame clearly shows the asymmetry. The frequency of alpha rhythm does not drop with age. No phase cancellation between hemispheres occurred with alpha rhythm, as it does not occur with beta rhythms. In addition, as I previously mentioned, during drowsiness, alpha activity spreads forward. It does not shrink in space with drowsiness. It must be stressed that the absence of alpha rhythm cannot be considered an abnormality. So the answer to this question is D. Which of the following does not represent an abnormality? A. Bilateral absence of alpha rhythm. B. Absence of unihemispheric alpha blocking with calculation and eye closed. C. Absence of unihemispheric alpha blocking with eye opening. D. Bilateral posterior alpha activity with no reactivity. There are several features that render alpha activity abnormal. Bilateral lack of reactivity. As you can see in this epoch, the alpha activity continues despite eye movement, in this case eye opening movements. Failure of alpha blocking with opening may be unilateral or bilateral. When unilateral, that is when the lack of reactivity involves only one hemisphere, we call it bank out phenomenon, to which I alluded before and will explain in a few seconds. When the lack of reactivity is bilateral, most likely we're going to be dealing with a technical failure if the patient is in normal condition, and the failure would be of not conducting the recording long enough or not noticing what happens after hyperventilation, which, as we previously mentioned, sometimes brings alpha rhythm that has not been present before in the recording. It could also be due to blindness. Bilateral acquired blindness can lead to failure of alpha blocking. Monocular acquired blindness can also lead to failure of alpha blocking if the normal eye is kept closed and the eye that we open is the one that is blind. Finally, bilateral failure of alpha blocking can occur with cerebral lesion. It is often seen in patients in coma, but it can also be seen in patients with unilateral parietal or occipital lesions without being comatose. This is the third time that I have mentioned bank out phenomenon, and I will proceed to explain it. This frame shows an EEG with alpha rhythm in the right and the left posterior regions. The difference in amplitude is probably within the normal range, since, as we know, the left side tend to be smaller in amplitude than the right side. But when the eyes are open, the alpha rhythm on the left attenuates, but not so the alpha rhythm on the right. This patient had a right posterior cerebral infarct. This phenomenon, that is the failure of alpha rhythm to attenuate when both eyes are open, is called bank out phenomenon. This frame shows another example of bank out phenomenon. The bank out phenomenon occurs with calculations in affected patients. So it not only occurs with eye opening, but also with calculations. Patients with bank out phenomenon usually have temporal or parietal lobe lesions. In the next few slides, I will tell you the correct explanation for this phenomenon. This is a view of the brain from below. In red, I have highlighted the optic radiation belonging to the inferior retina going through the temporal lobe. and in blue, those belonging to the upper retina traveling through the parietal lobe. It is the injury to these fibers that is blamed for the bank out phenomenon. So, in addition, another feature that can make alpha rhythm abnormal is the presence of an asymmetry. That is an asymmetry with the right alpha rhythm being lower than the left alpha rhythm by more than 25%, or the left alpha rhythm being lower than the right alpha rhythm by more than 50%. Usually, as we have previously mentioned, the amplitude of the alpha rhythm of the left hemisphere is lower than that of the right hemisphere by as much as 35%. Thus, this asymmetry is considered normal. When an asymmetry is present and the left side is the lowest by more than 50% of the right, then this asymmetry is considered abnormal. If on the other hand the asymmetry is present, but it is the right hemisphere, the one that has the lowest activity, the asymmetry has to be only 25% to be considered abnormal. In addition to a significant asymmetry, an alpha rhythm can also be labeled abnormal if the frequency difference of the right and the left hemisphere is more than 1 Hertz. As you can see in this frame, the activity present in the left hemisphere is significantly slower than the activity present in the right hemisphere. Another feature that can render alpha rhythm abnormal is the presence of a drop of more than 2 Hertz between 19 and 60 years of age. In order to make this diagnosis, we must have an EEG from the patient when the patient was younger and again when the patient was older. This is an example of such a case in which you can see that at 20 years of age the frequency was much faster, that is, the frequency of the alpha was much faster and very preserved than at 55 years old. These records belong to the same patient. In this frame, I have just highlighted that finding by putting lines that would make it easier for you to see the difference. Finally, an invariably alpha rhythm of 8 Hertz is abnormal, even in elderly patients, and it may indicate an encephalopathy. This epoch belongs to an EEG with sustained reactive alpha rhythm under 8 Hertz. This is an abnormal finding despite the presence of reactivity in its posterior location. So the answer to this question is A. Carbamazepine can produce slowing of the alpha rhythm. A true, B false. The list of conditions capable of producing a drop in alpha rhythm frequency presented in Fish book EEG primer is so long that it's not worth listing. In this frame, I have listed those that I think are more significant. Please take a moment to read it. I remember hearing Dr. Marsan telling me that dilantin toxicity could be monitored by measuring alpha rhythm frequency. High dilantin level is associated with slowing of the alpha frequency. So the answer to this question is true. Next question. Coma in a patient with good alpha rhythm reactive to eye closure by exam indicates that the most likely etiology for the coma is A. Hypoglycemia, B. Hypoxia, C. Pontine tumor, B. Brain tumor. Non-reactive generalized alpha activity in a comatose patient usually indicates hypoxic ischemic encephalopathy, hypoglycemia, or midline thalamic brain tumor. The same etiology must be considered if the alpha, instead of being diffusely present, is present in the frontal region. In either case, alerting stimuli do not produce any reaction. This epoch was recorded in a comatose patient and it is associated with poor prognosis. There was no reactivity and the alpha activity was predominantly over the frontal region. Unreactive alpha coma is also seen acutely during the first 5 days of a significant brain injury, and after 5 days it usually turns into theta or delta coma. An exception to this course is when the alpha coma occurs in patients that are comatose due to an electrical injury or are comatose due to an overdose in sedating drugs. In these patients, the prognosis is not as bad as it is in other patients, despite the fact that the alpha coma is unreactive. Non-reactive alpha coma with posterior preference can also be seen in pontine tumors. Reactive alpha coma with posterior preference can be seen in patients with pontine lesions, but they can also be seen in patients in what is called the locked-in state, which are patients that are aware of their surrounding but are unable to communicate at all. This epoch belonged to a patient with coma due to head trauma with sign of pontine involvement. In this case, pinching the left arm produced an arrest or blocking of the ongoing alpha activity. So the answer to this question is C. Please take a look at this frame and choose the best answer. A. Ictal pattern. B. Alpha activity. C. Eyelid fluttering. D. Mu rhythm. Rhythm in the alpha frequency that appears only or mainly in the frontal region is abnormal. Alpha frequencies that occur restricted to the frontopolar region should be considered to be eye movement artifact until proven otherwise. So the answer to this question is C. Next question. Please look at this frame and try to find the best choice. A, alpha rhythm. B, alpha activity. C, spindle. D, mu rhythm. The answer refers to the grapho element pointed by the arrow. The answer to this question is D. Next question. Mu rhythm is more frequent in female teenagers than in male teenagers. A, true. B, false. Mu rhythm is considered by some to be the electrical response to idling of the sensory motor cortex. This frame shows Brahman areas likely involved in the generation of mu rhythm. Mu rhythm is first present at 2 years of age, but some authors trace their initial presence to 8 months of age. Unlike alpha activity, mu rhythm is uncommon. It occurs in 5% of tracing of patients less than 4 years of age, and its peak occurs during adolescence. At the time, mu rhythm is found in 20% of the recordings. During teenage years, mu rhythm is more common in females than in males. Most textbooks define mu rhythm as an activity in the 7 to 11 Hz band width. Central dominant, best seen while awake under the same conditions as alpha rhythm, blocked by movement of any kind and even by thinking about movement. So the answer to this question is A, true. Next question. A 16 Hz central rhythm that is only present in a patient while awake and relaxed, that is not blocked or attenuated by eye opening, but it is blocked by tactile stimulation, should be classified as mu rhythm. A, true. B, false. Mu rhythm must be distinguished from wicked spikes and ictal epileptiform activity. It occurs during any stage, is not associated with any artifacts. It is best detected using double banana montage with added transverse runs. Ipsilateral reference montage may help with certain features, but overall is a far worse montage to use when trying to evaluate mu rhythm. The waves that constitute the mu rhythm are arch-like. They have been described as comb-like or wicked. Using bipolar montage, the amplitude with regular electron separation is about 50 to 75 microvolts. It occurs in bursts lasting a few seconds with a prevailing frequency that is stated differently by different authors. In Fish book, they give a frequency of the wave within the burst to be 7 to 11 Hz, in Everson 8 to 12, and in Hugh then mentioned that the frequency of the wave in Moore rhythm is 1 Hz faster than the alpha rhythm in the same patient. Other authors defining Moore rhythm by their reactivity have attached to Moore rhythm faster frequencies ranging from 8 to 25 Hz. These authors have also considered Moore rhythm to be a non-unitary phenomenon involved in the transformation of seeing and hearing into doing. Yet the usual frequency given for Moore rhythm in most textbooks is 11 Hz. Moore rhythm is maximal over the central regions. It may be synchronous, but more often is asynchronous, with alternating asymmetries. Moore rhythm is probably abnormal if it is present only on one hemisphere or consistently asymmetrical. Moore rhythm reactivity is quite specific and complicated. Hence, I will use a new frame to describe it. Moore rhythm is unaffected by eye opening or closing. This frame is an example of that. You can see that despite the eyes being closed or open, Moore rhythm persists. Moore rhythm is blocked by voluntary, passive, or reflex movements, intention to move, and by tactile stimulation. Tactile stimulation specifically blocks Moore rhythm in the contralateral hemisphere to the site stimulated. But also at times, Moore rhythm may be triggered by touch if the patient is drowsy. Fatigue and problem solving attenuates Moore rhythm. Another characteristic of Moore rhythm is that it is inconsistently present. You may find it one day and then repeat daily the next day and not find it. And it is prominent overlying skull defects. I have shown you this epoch before to indicate the effect of eye opening and closing on Moore rhythm, which there's no effect. I am showing you now to demonstrate that when the fist is clenched, there will be disappearance of Moore rhythm. The defining features of Moore rhythm are its central location, that it does not disappear with eye opening or close, that it occurs in bursts of relatively short duration composed of waves in a arcuate fashion. So the answer to this question is true. Next question. A 20 Hz central rhythm intermixed with 10 Hz activity that is present with eye closed and open but disappeared when feasting is A, a mood rhythm, B, a beta rhythm, C, a fast mood rhythm, D, all of the above. Mood rhythm, defined by its reactivity and location, can produce relatively fast activity. In this study, 20 Hz activity was detected with the same characteristic that we usually use to label a rhythm, mood rhythm. So the answer to this question is A. Next question. Which of the following is abnormal? A, a frontal mood rhythm, B, a frontal alpha rhythm, C, a paradoxical mood rhythm, D, a paradoxical alpha rhythm. If you are asked in an exam for the frequency of alpha and mood rhythm, I think that it is best to say 8 to 13 Hz for alpha and 7 to 11 Hz for mood rhythm. But there is a paradoxical alpha and a paradoxical mood rhythm. Paradoxical alpha is seen when with eye opening from drowsiness. Paradoxical mood rhythm is seen with touch when a patient is also drowsy. A slow alpha and mood rhythms have waves in the theta range, and fast alpha and mood rhythm in the beta range. The distribution of alpha is maximal posteriorly but may spread centrally. Mood rhythm is maximal centrally but may spread forwards, anterior towards the frontal lobe. So the answer to this question is B. Next question. Theta waves of higher amplitude than the ongoing background activity after 19 years of age during a wake are abnormal. A true, B false. Theta rhythm was introduced by Grey Walter in 1936. Grey Walter was the same doctor who is credited with the invention of artificial intelligence. Some say he used theta to label brain waves from 4 to 7 Hz because he thought these waves were from the thalamus. And since thalamus and theta starts with the same letters, he decided to use it. I do not know whether this is true or not. I'd like to point out to you before going into the adult world that during the teenage years there is a resurgence of theta activity in the frontal and in the central regions, but not in the occipital region. The reason why I mentioned this to you is because I've seen these questions in one of my exams. But as you can see in this figure, theta waves are not present after 20 years of age, except perhaps for some in the 7 Hz range. This table, which I have shown you in the past, summarizes the presence of different rhythm at different ages. As you can see, any theta activity after 19 years of age is generally considered abnormal. Yet, general description of EEG, certainly during sleep, but also during awake and relax with the eyes open, and awake and worried with eye closed, mention the presence of theta activity. In Fishbook, some guidance are provided to determine when theta activity of waves should be considered normal. The guidance they provide states the following. For theta wave to be called normal, they should be single waves without focal, regional, or lateral predominance. They should be asynchronous, not higher in amplitude than the background activity. If present in sequence, they must be part of a harmonic activity or part of a normal grapho element. But remember that there is a significant amount of theta activity between the ages of 8 and 16 years of age. In elderly, there may be more left theta waves in the temporal lobe than in the right temporal lobe. And at times, theta activity becomes prominent during hyperventilation. So theta wave conforming to these parameters, that is normal theta, may occur in all behavioral stages. So the answer to this question is true. Next question. Which of the following rhythms have been associated with mental effort? A alpha, B beta, C kappa, D theta. Kappa rhythm consists of bursts of activity in the alpha or theta range distributed in the temporal lobe, facilitated by mental effort of very low amplitude. Rarely this activity is seen. It is not really known whether it represents mental effort or rhythmic eye movement associated with eyelid fluttering. So the answer to this question is C. Next question. Delta waves after 19 years of age during a wake is abnormal. A true, B false. Delta waves are waves with a frequency of less than 4 Hz. Should not be present during a wake or in REM sleep stage. They may be present during stage 1 sleep, but only less than 20% of the epoch can be occupied by these waves. The same stands for delta waves during a stage 2 sleep. Delta waves occupy more than 20% of the epoch in sleep stage 3. So the answer to this question is true. Thank you.